Welcome to Series 2 of the Latte Lounge podcast. Join me, Katie Taylor, as we talk balancing hormones, busting myths, breaking taboos, boosting libidos, and bolstering confidence. Why not grab a coffee, take a seat, and join us in the Latte Lounge as we chat all things midlife, menopause, and beyond. With thanks to our friends at Clarence for making this podcast possible. In this episode, I'm going to be talking to Menopause Specialist Dr. Naomi Potter. We're going to be looking at one of the most common and troubling symptoms of the menopause, hot flushes and night sweats. We'll be addressing why some women experience them and others don't, the impact on our mental and physical health and relationships at home and in the workplace, as well as discussing what holistic and/or medical treatment options we can all consider to help combat them. And stay tuned, as we'll also be discussing why hot flushes could potentially be a warning sign of cardiovascular disease, poor brain health, and why addressing them before the age of 60 is so important. Dr. Naomi Potter qualified as a doctor in 2003 after first achieving a master's degree in psychology. After 16 years practicing as a GP for the NHS, she now specialises solely in menopause care and treatments. Naomi's extensive training includes the advanced certification from the British Menopause Society under the mentorship of Professor Nick Panay. She believes passionately, as we do, that women should have access to clear, evidence-based information to help them make informed choices on managing menopause. So welcome, Dr. Potter. Thank you so much for joining me today.
Thank you for having me. It's lovely to see. It's really lovely to see you. It's lovely to be doing this. Thank you.
Oh, well, this is fantastic. Now, listen, I wanted to talk to you about hot flushes and night sweats, because we all know, or we all hear, that these are one of the most common symptoms that everyone assumes is really the only surefire way of knowing you're going through the menopause, other than perhaps having no more periods. And yet, for me personally, I actually never had hot flushes and I was still having periods. And yet the sort of, I hear from women in our Facebook group community, and I'm sure you hear all the time in your clinic, that the knock-on effect on our confidence, our ability to work and function at home, and sleep and relationships can be pretty devastating. So I just thought I'd love to ask you first, sort of, what are hot flushes and night sweats for those who perhaps don't know or haven't experienced them?
So hot flushes are one of those symptoms that is almost stereotypical of the menopause, isn't it? It's what everybody has heard of. It's that classic image of a woman kind of fanning herself out in the open air, having kind of gone out from somewhere. And it is, and they can, although people joke about them, they can have a big impact on your quality of life. Firstly, it's embarrassing sometimes, especially if it's happening at work or you're in the middle of a presentation. And also it can make you feel very, very uncomfortable. Essentially, I mean, every woman's experience of them is slightly different. So it's not absolutely rigid, but what tends to happen is you have a sudden overwhelming hot feeling in your core that kind of travels up, and it's accompanied by a kind of flushing of your face and a lot of sweating. And it's embarrassing. It can mean that you have to change what you choose to wear, that you might not choose to wear any coloured clothes. You might have to have lots of layers. They can be really debilitating, very uncomfortable. And so a night sweat is something similar that happens at night. So often when you're asleep, and the first thing you might be aware of is being freezing cold because you've been sweating, your clothes are absolutely drenched, and then you feel cold as a result of being in a puddle of sweat. And then that can have that knock-on effect, whereas you can't really go back to sleep because you're freezing cold, you're wearing wet clothes, you've got to get up, get changed, change the bedclothes, and then by the time you do go back to bed, you're awake again. And that then leads to all of those consequences of not having a good night's sleep.
Yeah, it's interesting, isn't it, why some women get them and others don't? I mean, what is happening in our bodies that triggers them? And are there sort of certain, I don't know whether it's sort of food or drinks or lifestyle factors that make it worse for some?
Well, it's thought that estrogen has a direct effect on a part of the brain called the hypothalamus, which is in charge of temperature regulation. And nobody knows the exact kind of pathway as to what happens, but that decline or turbulence in estrogen is thought to trigger this almost like a malfunction in your temperature sensor. And so it tricks your brain into thinking that either you are very hot, in which case you need to cool down, or sometimes the reverse happens. So you do hear of women, it's not quite so common, having cold flushes and kind of cold moments where all of a sudden they are absolutely freezing and they can't get warm. And it's thought that that's just literally the reverse. But there are lots of triggers. So, and a lot of women can manage their hot flushes, but just literally by lifestyle changes. So things like alcohol, spicy food, smoking, even exercise can trigger hot flushes. And so by making adjustments to your lifestyle, it can help improve that symptom.
And what about, you talk about exercise, and exercise obviously is really good for managing menopause symptoms, but are there better exercises, for example, things like sort of more meditative type approach, like perhaps yoga, rather than, I don't know, going for a sprint or a marathon?
I mean, sometimes if you do an exercise that is going to put your metabolic rate up a lot and you are going to get hot and sweaty anyway, it can trigger hot sweats. But some women are like, well, it doesn't matter because I'm hot, I'm kind of going to get hot and sweaty anyway. There are things like mindfulness, yoga, Pilates, and even CBT is thought to help with hot sweats. And it's hard to know whether it is your perception of their impact that it has an impact on. So even though you're having the same number of hot sweats, just their impact on your life is reduced, or whether it does actually reduce the frequency and intensity of them. Either way, it doesn't really matter. If it's less impactful, it's less impactful, and it really can make a difference.
Yeah, I've heard it from a lot of women that once they gave up coffee, it made a difference, and that coffee tended to trigger it. And I just feel so sorry for women, and especially women who are perhaps wearing uniforms, whether they're, doctors or nurses or in the police force. Is there anything that you would recommend in terms of, getting dressed before we go on to sort of what medical treatments are available? Is there any suggestions on what women should wear?
Yeah, the nurses' uniforms that are that mid blue that show up the tiny. Can you imagine being really sweaty wearing one? It would be awful. And scrubs, even that mid blue of scrubs is just it's so embarrassing. I guess in terms of what you wear, it needs to be layers. It needs to be breathable, natural fibers rather than man-made fibers. And I guess if you can wear things that are loose fitting rather than tight fitting, and this is another is that workplaces are becoming more menopause friendly. And if you've got a menopause mentor or somebody in charge of menopause policy at work, it's worth discussing with them changes to what you can are allowed to wear at work to make you more comfortable. And it sounds like a small thing, but actually, if you're at work 5 days a week, it's your entire kind of active day, isn't it, for the whole working week? And it can
absolutely. And you're right, you can make some very simple adjustments, whether if you're desk bound, sitting by an open window, or asking for a fan, or working perhaps remotely if possible. There are lots of women who, for either medical or surgical reasons or personal choice, don't want to try something like HRT, which I want to discuss with you in a minute. So, I wanted to have this kind of conversation about what else, what could help, whether there's sort of any herbal remedies or other sort of treatment options. Perhaps, I don't know, things like antidepressants do or don't work. So could you talk a little bit about what the medical treatment options are for those that can or can't take HRT, and why HRT does help for those that can?
So HRT is a very useful tool for treating hot flushes because it works pretty much invariably. Replacing estrogen stops hot flushes and night sweats if you get your estrogen levels up to satisfactory levels pretty much universally. very occasionally you might see somebody whose hot flushes and night sweats aren't stopped by that, and then you actually look for other underlying causes because it's so unusual. But there are some women who can't take HRT. There are also women who don't want to take HRT, and there are other options. There's the options that we discussed before about, you know, lifestyle changes and psychological therapies, but there are some medications that we do sometimes use that can be effective in treating hot flushes. There's a particular type of antidepressants that can work. There's a medication that we use for treating bladder overactivity called oxybutynin that can be very helpful. So both antidepressants and oxybutynin will be my kind of number one goes to as an alternative. There's also a new medication that's being trialed at the moment that's really quite exciting. It's not out yet, but in the next couple of years, it's thought that might be, and it's non-hormonal. That it might be a game changer for women who can't take HRT, but it's not here yet, but on the cards.
Well, we'll watch out for that. You heard that here first. That's really, I mean, it's really good to know that there's other things coming in the pipeline. I mean, it's interesting because for those that joined us at the Midlife Festival, and for those that didn't, you know, we'll share some links to it afterwards. We had a really interesting conversation, and I'd love your thoughts on this. With Professor Philip Sarrell, who's a professor of obs and gynae at Yale School of Medicine, and he was saying that hot flushes are perhaps more than just an inconvenience; that they could be a risk factor for and a warning sign for heart disease, bone loss, and even late life dementia. And so, he was explaining to me that some of the most recent data has shown quite sadly that women, 1 in 2 women are dying from cardiovascular disease, and it's the leading cause of death in women, and that we should all be having a sort of checkup on our cholesterol level before the age of 60. So I just wondered what your thoughts are on that, and why, kind of why that is.
What we understand is that estrogen is protective from a cardiovascular and a bone point of view. So if you look at so premenopausal women, it is very, very unusual for them to have any kind of cardiovascular disease because their estrogen protects their heart and their vessels. And then so after the menopause, when you lose your estrogen, that's when women tend to start to develop heart disease and vessel disease. Whereas with men, because they don't have the estrogen like women do, their rates of cardiovascular disease tend to just kind of increase. They increase kind of gradually over the course of their lives. Whereas women, you kind of fall off a cliff in their, postmenopausally. And so that's what we understand about estrogen, which is why HRT is protective from a cardiovascular point of view. And it's one of the thoughts that, so if you have a vessels changing, so when you have a hot flush, you have the vessels expanding, that's what you see. You're seeing something called vasodilation. In the same way as women with migraines, it's thought to be slightly predictive of an increased risk of stroke if you are somebody that experiences a lot of migraines. So we don't fully understand how all of these things work, but we do understand that postmenopausal women are at a much higher risk of cardiovascular disease than premenopausal women. And we know what leads into that. So it's things like high cholesterol, high sugar, so diabetes, pre-diabetes, not exercising, smoking, alcohol. All of those things play a role in furring up arteries. And if we do things like we lower cholesterol, we keep sugar under control, we exercise, we don't smoke, we don't drink too much alcohol, all of those things independently can reduce that risk of the vessels furring up, and therefore of things like heart attacks, angina, strokes, peripheral vascular disease. So that's when the vessels in your legs get hardened and cut off blood supply down there. So it's about looking, it's like all these things, isn't it? Big picture, everything has an interplay. We can't control the fact that as we get older, then the risk of cardiovascular disease goes up, but there are things that you can do to reduce that risk.
Yeah, absolutely. And I think it's just very sensible anyway, isn't it? As we're in this sort of midlife and menopause phase, that we all actually stop and try and take perhaps better care of ourselves, because I think our youth is catching up with us now, so there is never a better time. And what would if you had some sort of top tips or words of advice for not just for people who are going through hot flushes and menopause in general, but also for employers and partners who are probably listening now, how can we all basically support each other to make sure that we can stay in the workplace and stay in our relationships and just manage these sort of debilitating symptoms when they arise?
I think it's about open dialogue, isn't it? And non-judgmental environments. And for employers particularly, like it's two-pronged. It's firstly like being human and looking after your employees because you're good people and you want to make sure that people are happy, but also it makes business sense to look after your employees. You've got these women who are highly trained, highly skilled, they're leading corporations, and then you lose 10% of them completely unnecessarily. And then you've got, absenteeism, you've got to recruit, you've got to retrain. It makes sense to look after these highly, highly valuable resources if you want to be really cold about it. And it's really not that hard to, you have menopause policies, you have menopause mentors, you make it an open dialogue. It's not a joke. That's one of the things that I think is really important. It isn't it's a no joke culture, and it works. It really works. And in the same way for partners and friends and family, like having just those basic principles of, we are open about this. It's not a joke. Women can be supported through it and be fine, but there can be a bit of turbulence whilst they are sorting things out. It's just about support and understanding and empathy, and you do get there with that framework in place.
And someone was asking me, it's quite an interesting question, I hadn't thought about it, perhaps because I'm personally had a hysterectomy, so I'm only on estrogen. For those that are listening who might not have heard our previous podcast, for women without a womb, you don't necessarily need progesterone. So for me, I'm just on estrogen. But a lot of women, again, who either are on HRT or don't want to or can't, they always say, is there an end game? So will I get through menopause after a few years, and then will symptoms like hot flushes eventually stop on their own, or am I going to be suffering with them forever?
It's you can't absolutely totally predict. The majority of the worst symptoms occur during the perimenopause and just into the menopause, when you have that turbulence of hormones, but also the change from having estrogen to not having estrogen. And then in a lot of women, and probably the majority of women, the body gets used to not having that estrogen around, and symptoms on the whole settle. Now, they may not completely disappear, but they do tend to settle. In some women, they don't. So you can have women who have been menopausal for 20 or 30 years and they're still having hot flushes and night sweats and all the symptoms that can go with it. So there's no way of predicting, but the majority of women will go through it, and then their bodies just settle into not having estrogen around. But it's you can't predict who that's going to be.
Yeah. And I think it's particularly difficult for women who've been through, say, breast cancer and are on tamoxifen or whatever side effects of their treatments are, that it can be, it's bad enough having gone through all that, but then having to suffer as well with these symptoms. I just feel terribly sorry for women. You've written a fabulous book, which I've been very lucky to have read. But for those that may not know, and I'll be amazed if they don't know, tell everyone what the book's called, who you wrote it with, why you wrote it, and also what women will find, not just women, employers again, and partners, and all people going through menopause. What will they find?
Oh, thank you. So it's called Menopausing, and it's a book that I wrote with Davina McCall, and it's a guide to the perimenopause and the menopause, but it's also got lots of real women's stories with from all sorts of different backgrounds. And it's been amazing what women have shared with us. But I think what it does is it makes it relatable. So there's so many different angles there that I think the feedback that we've had is that a lot of women feel that they've been heard and understood, and they can relate to the experiences that those women have been through, and hopefully kind of learn from that, and put up with less, like, if not sit and wait and hope that they just get through on their own and seek help. And it's it's kind of, I think it covers all bases. I hope it covers all bases. That was the plan. So it's just a kind of little, it's a guide to all things perimenopause and menopause.
And it's the reason I love this book, and it's very similar to the reasons why I set up the Latte Lounge. I think when you're struggling, you tend to look online, and 7 years ago when I started, all I ever found was an NHS website, and although it's very good in terms of evidence base, it was very medicalized speech, and it wasn't it gave me very sort of medical approach. And so what I love about the book, which you've so beautifully managed to do, and I kind of really relate to it in terms of the way you speak, is that all the evidence and information that you could ever need is in there, but it's written in a very easy to understand way, and also a fun way. You can hear, for those who are listening not in the UK, by the way, may not know who Davina McCall is, which I'd be amazed. It's written in a very relatable sort of tone of voice. It's very relaxed, and it's how we all chat, and I think that's the beauty of that book. That comes,
you can hear Davina's voice behind it.
I was using my words carefully, but there's a fantastic quote in there. I can't remember. She basically said, it's all bollocks. Not the book, it's just I can't remember what she was referring to. But anyway, on that note, where can people find out more about the book, and also about you and your clinic too?
Oh, thank you. So the book is available from at most retailers. I think it's on Amazon. It's on Waterstones. I think it's in WH Smith. And it's called Menopausing. And there's an audio version as well. So it comes as an audio book. And a lot of women have said that that's how they go about their day, and they go to the tube and they do the housework and they're doing the cooking and picking the kids up from school or whatever with it on, and they've really enjoyed that. So that's where the book is. I do a lot of stuff on Instagram, and there's loads of information there, and I do mini videos. And my Instagram handle is Dr._Naomi Potter. And my clinic is Menopause Care. So the website is menopausecare.co.uk. And we see most of our patients online from anywhere in the UK. I've got about 15 doctors who all work to the same ethos as me, and we've also got 3 clinics, in face-to-face clinics. We've got one in Sheffield, one in Wimbledon, and one in Barnes now. So we've got that face-to-face option if that's what someone prefers.
All right, well, we'll put all those details in the show notes, but thank you so much, Dr. Potter, for joining us today and talking about hot flushes and night sweats. I hope everyone found that helpful. And do reach out to us if you would like us to put you in touch, or send you some resources to go with this podcast. So hope everyone found that helpful, and have a good day. Thanks for listening to the Latte Lounge podcast. Please subscribe wherever you're listening so you don't miss our next episode. For more support with all things menopause and midlife, head to our website lattelounge.co.uk and search for the Latte Lounge group on Facebook. This podcast was sponsored by Clarence and produced by Emily Crosby Media.